First time we've got community spread, 4 individuals. So we're going to have Dr. Zink and Commissioner Crum talk a little bit about the specifics to the case to the extent we can, and where we are with the health mandates and advisories. I also want to take this moment to thank all of the healthcare professionals in the state of Alaska. They're going to be on the front end of this protection of Alaskans here very shortly. As a matter of fact, they've been gearing up for some time. Dr. Zink will talk more about that. But it's our healthcare professionals that are going to be the frontline troopers as we go through this process. We all have our part to play. We've talked about that. Distancing ourselves, washing our hands, not going into crowds, doing our part, all of us sacrificing a little bit now so we can all, Alaska can gain a lot more later. We're going to be going through this process for the next 2 weeks at least, and we're going to be evaluating what we do every day in response to this virus. We are in a pandemic. We do have a virus. It is spreading across the globe, spreading across the country. It's here in Alaska. We knew it would be here. Nothing so far surprises us. We know this is going to be a challenge for all of us. We're going to be tried, all of us, through this process. But as I said, I think we have what it takes to overcome this virus and to deal with it. Will some of us get sick? Yes, obviously, 36 cases. Are there many more that are probably infected right now in Alaska? Yes, there probably are a lot more. Will there be people that will be hospitalized as we go through this? Absolutely. And will there be some Alaskans that this virus will cause their death? There'll be some. But again, we're in the process of standing up our defenses to this onslaught from this virus. And I believe Alaskans will be prepared for this to the best extent possible. We see other states such as New York, California, the state of Washington. They've kind of been on the front lines for some time. New York's cases are growing. They're getting assistance and resources to help combat this. Same with California, Washington, Ohio. All the states now are infected. So we're going to talk about what we're doing here in Alaska, and we'll have some more details tomorrow, but we've got a lot of Alaskans mobilizing themselves, looking out for each other, looking out for seniors in their neighborhood or relatives. They're checking in on them. We've got individuals that are looking out for those that are medically fragile and vulnerable at this time to potentially catch this virus. They're doing shopping for them. They're looking after pets for them. They're picking up their medicine for them. I mean, this is what we do as people. This is what we do as Alaskans. And I also want to take this time to thank all of our state and municipal workers in the state of Alaska. Our state and municipal workers are considered critical infrastructure. In other words, for the most part, they have to remain in place and do their jobs. Some of those individuals in the state and state municipal government will be able to do their jobs off campus or from home. Some won't be able to. And you can think of some of those folks like your troopers and your police and your firefighters. There'll be others that have to come to the office because just the nature of their job requires that to happen in order for our government to continue to function. If we could send everybody home in state and municipal governments, and if we thought that our governments could function, our society could function, our civilization could function if we could do that, we'd certainly do that, but we know it can't. So when you see a healthcare professional, when you see a police officer, a law enforcement officer, a trooper, an emergency responder, when you have a friend, a neighbor that is a state worker, and you know that every day they're going to get up and they're going to go to work to help all of us in Alaska, and that we all run the risk, and many of us will catch this virus. The vast majority of us will get through the virus with minimal illness. But as I mentioned, and we have to be honest with each other, some of us are going to get sick. Some of us will get pretty sick. But again, this is the time, I think, where Alaska shines. This is the time where I believe Alaska shows this country, shows this world, what this very large state, very far north, is all about. It's a beautiful place, but in the end, what really makes this state the state it is you. It's the people of Alaska. It's us. It's the health responders. It's the volunteers. It's the companies who right now, and we'll give a report tomorrow, it's the companies who right now in Alaska, who never thought they'd be asked to retool and look at helping us construct ventilators, protective personal equipment for our first responders, our health care folks, for having to retool to make hand sanitizers. You know, we never thought about Alaska in this manner, or Alaskans. But you'd be amazed at how many Alaskans are standing up, asking what they can do. And as I said earlier, just small things like helping your neighbor, helping an elder, helping a senior, picking up medicine for folks, picking up groceries for folks, shoveling their sidewalks, doing things for them, but being smart about it, keeping 6 feet away from folks, washing your hands as much as possible, not going into crowds, and just helping everybody for the next couple weeks as we hunker down, and that's what's going to happen, as we slow things down in an effort for our healthcare professionals to build up our healthcare capacity. This time is going to be critical. This time is going to be critical for all Alaskans. And again, these are the times that Alaskans really shine. And so we're going to get through this. Alaska's going to get through this, the world's going to get through this, the country's going to get through this. And I know many of us never thought we'd be standing here today talking about a pandemic in 2020. The fact of the matter is, every generation gets tried. Every generation goes through their trials and their tribulations like we are today. But if history shows us anything, we come out of these things stronger. We come out of these things better. And I'm willing to make a bet today that when we come out of this world, this country, and this great state we call Alaska is going to be much better prepared for any pandemics going forward. There's going to be changes in the way we live. We're doing that now. There's going to be changes in the economy. We know that as well. There's going to be changes in our behavior, and a lot of Alaskans are demonstrating that as we speak. But even though this may be an uncomfortable time, even though this is going to be a difficult time for a lot of Alaskans, it's going to be a tough time for our economy. And that's another thing I would like to say to people. Do your best to help our economy. Adopt a restaurant. Order your food out. Think about, if you are a business, if you can hire folks, whether you're in the grocery industry, whether you're in the shipping industry. We aren't going to be able to do this forever. We aren't going to be able to put things on hold forever. And sooner than later, we're going to have to get back into living, get back into working, get back into the lifestyle that we've known our entire lives. And we'll do that. But for the next couple weeks, if we all pull together, if we all pull ranks, we tighten up, we work together, we can help our healthcare professionals build up the capacity that we need and get through this. So with that, I'd like to have, I think it's going to be Doctors Inc., or is it Adam first? Adam's going to come up, Adam Crum, from the Department of Health and Social Services, and he's going to have a few words to say about the mandates and the advisories, and then Doctors Inc. will talk about the cases and where she thinks we're going.
Good evening. Today, the state of Alaska is issuing its 9th health mandate based on the authority under the Public Health Disaster Emergency Declaration signed by Governor Mike Dunleavy on March 11th, 2020. Given the increasing concern for new cases of COVID-19 around the state, Governor Mike Dunleavy and the state of Alaska are issuing the following mandate to go into effect March 24th, 2020 at 5 p.m. The purpose of this mandate is to limit all close contacts, people outside of a family unit, to be farther than 6 feet from each other to prevent the spread of the virus that causes COVID-19. So mandate 9.1, State of Alaska personal care services and gatherings. All businesses, congregations, or gatherings in the state of Alaska where individuals are within 6 feet of each other must stop all operations. This includes hair salons, day spas, and aesthetics locations, nail salons, barber shops, tattoo shops, body piercing locations, massage therapy locations, and tanning facilities. Additionally, no gatherings of more than 10 people may take place, and if a gathering does take place, people must be 6 feet apart from each other. This mandate prohibits the delivery of services in any of the above business locations by individuals holding licenses issued by the Board of Barbers, Hairdressers, and Board of Massage Therapists. It shall take effect March 24th, 2020 at 5 p.m. and remain in full force and effect until the governor rescinds or modifies the order. The main point of this one is to make sure you do social distancing. Limit the size of your gathering, so no more than 10 people, and maintain your 6 feet away. If you go grocery shopping, don't bring your entire family into the store. Send one individual to go in. Make sure there's proper spacings in line. Let's give each other an opportunity to use this for social distancing to really slow down the spread of this disease. This is our opportunity to do so around the state to help each other out and look forward. Another health mandate is health mandate number 10. Given the increasing concern, this Governor Dunleavy and the state of Alaska are issuing the following mandate to go into effect March 25th, 2020 at 12:01 a.m. and it will be reevaluated by April 21st, 2020. This mandate is issued to protect the health of all Alaskans. The governor looks to establish consistent mandates across the state in order to mitigate the impact of COVID-19. The goal is to flatten the curve and prevent the spread of the virus. The purpose of this mandate is to control the ingress to Alaska from outside localities in order to prevent the spread of the viruses that cause COVID-19. So this is Health Mandate 10.1, International and Interstate Travel, Order for Self-Quarantine. Effective 12:01 a.m., March 25th. All people arriving into Alaska, whether resident, worker, or visitor, are required to self-quarantine for 14 days and monitor for illness. Arriving residents and workers in self-quarantine should work from home unless you support a critical infrastructure, which is described in what's going to be posted as Attachment A. Critical infrastructure is vital to keeping Alaska safe, and as a result, businesses and employees of critical infrastructure industries must take special care to protect their staff and operations during this pandemic. If your business is included in Attachment A and your workers must travel to enter Alaska, you must submit a plan or protocol for maintaining critical infrastructure to the Department of Commerce, Community, and Economic Development by 3 p.m. March 24th, outlining how you will avoid the spread of COVID-19 and not endanger the lives of the communities in which you operate, of others who serve as a part of that infrastructure, or the ability of that critical infrastructure to function. Along with this, pursuant to the declaration, the state of Alaska hereby orders the following upon arrival in any community in Alaska from another state or nation. Proceed directly from the airport to your designated quarantine location, which is the location identified and affirmed by you on the mandatory State of Alaska Travel Declaration form. If you're a resident, your designated quarantine location is your residence. If you're a visitor or worker, your designated quarantine location is your hotel room or rented lodging. Remain in your designated quarantine location for a period of 14 days or the duration of your stay in Alaska, whichever is shorter. You may leave your designated quarantine location only for medical emergencies or to seek medical care. Do not visit any public spaces. Do not allow visitors in and out unless authorized by the Unified Command. Comply with all rules or protocols. And if you are required to self-quarantine and there are other individuals in your residence, hotel, or rented lodging, you're required to comply with social distancing guidelines. This mandate supersedes any local government travel restrictions. The failure to follow this order is punishable by a fine of up to $25,000 or imprisonment of not more than 1 year or both pursuant to Alaska Statute 1255-35 and Alaska Statute 1255-135. Thank you. We'll go to Dr. Zink now.
Hello, I'm Dr. Zink. I am the Chief Medical Officer for the state of Alaska. I appreciate everyone's patience and time, and this is a lot. This is a lot of mandates, there's a lot of changes. There's a lot going on in the world right now with this pandemic. I've been struggling with how to share that, and I thought I would just take a few minutes to kind of share a few steps in my experience with this to kind of help put it in perspective. I remember back in December when I went for a hike with my predecessor and hero, Dr. Jay Butler, who had this job before me and who now works at the CDC. And we were talking afterwards. It was -13, and it was a beautiful Alaskan day. And he got a call that there was this breakout in China. And I remember him saying, "Oh, it sounds like a coronavirus." And I remember thinking, man, I wonder what that's going to look like. And then I remember at the end of December when we heard China announce that they had cases. And I didn't know if this would just be a flare or if this was going to be like SARS, with a bunch of public health workers working diligently around the clock, and essentially the world was able to dodge a bullet with that pandemic. And we continue to watch it, and we all watch what happened in Wuhan, and we watch what happened in China, and we watch these big lockdowns and hospitals being built and people going in and out with masks, and we were all trying to figure out what does that mean here and what does that look like here. We also saw fellow Americans stuck in Wuhan and helped with the repatriation effort. Since that time, for over 8 weeks now, our Emergency Operations Center has been up and has been running and has been active and essentially working around the clock for over 8 weeks now, trying to get ready and prepare in whatever way possible for the day that we would see this virus in Alaska or in the United States if that day ever came. I remember the time that we first saw cases show up in Italy that didn't have any known traveler contact. This was Italy is a country where we knew some of their healthcare infrastructure. There was a sense of how could this happen here, what exactly was going on, and we've been all watching what's happening in Italy, watching cases go up and death counts go up. And I remember I was in DC meeting with my colleagues from around other states who have a similar position as myself, and we were meeting with the CDC and ASPR and our federal partners, all talking about how we can support our states the best possible way. And I remember that day when we first found out in California that there was a first community transfer case. And it felt like a sucker punch. It felt like, oh man, here this is, and what's going to happen next? And honestly, for me, yesterday was a similar sort of day. I tried to take a quick break and get outside. It was beautiful here in Anchorage. And I went outside and got a call that we had really our first community case here in Alaska. And again, it felt like a sucker punch. It felt like we're doing all this work, and it's so critical we're doing this work. But this virus is like fighting a war, but it's a war against this silent, sneaky killer that is transmitted by the healthiest, youngest people who may have the smallest symptoms, and then without even realizing it, infect the elderly, people who are pregnant, people who have underlying medical conditions. And unlike influenza, where it may take a day or two for someone to start to show symptoms, this takes longer. It takes somewhere between 5 to 7 days to start to show symptoms. It can take up to that 14 days. That's why we have this 14-day window where we're watching for signs and symptoms. And it feels like fighting this war on multiple fronts. And so that's part of the reason why we continue to escalate these advisories and mandates, is because we really owe it to all Alaskans to protect your health and well-being. When I look back over this weekend in the cases, we had 10 cases yesterday, 4 from the Anchorage area, 1 from Juneau, and 2 from Matsu. 3 were between the ages of 19 and 29, 5 were between the ages of 30 and 59, and 2 were over the age of 60. Of those, 4 of which had no clear source and are considered community cases. 3 were travel-related, 2 are still under investigation, and 1 was a known close contact to a previous case. Today, we still have many tests running, but we have 4 more additional cases of today. All 4 are in the Anchorage area. All 4 appear travel-related. 1 is between the age of 19 and 29, 2 are between the age of 30 and 59, and 1 is over the age of 60. So this brings our total case count to 36. We've had over 1,000 tests that have been performed. We continue to see increasing testing across the state. We're working really hard to keep in front of that. It's important to remember that the test is not preventative, so getting the test doesn't mean that you're not going to get the disease. So we don't test asymptomatic people to clear them to go back to work, even if they're part of a critical infrastructure. And so it's really important to remember that test is just a critical tool in being able to use to determine the location and place of these cases and contain it and try to mitigate further spread. We will continue to see increased cases being tested both here in the state lab as well as our private labs. We're making sure that there is equal distribution across the state for everyone to have access to the swabs to perform the test, and as soon as the swab comes into the state lab, perform that test. Each individual community decides if they want to send it into the state lab or to the private labs down in the lower 48, and that's their decision. We don't have any control over the turnaround time in the lower 48 and when those results will come back. Here at the state lab, we're still able to turn around all tests that we get within a day of the test being received for us. We did change our health guideline on who should be tested, and again, it really focuses on people who are symptomatic and those who are at risk, including those who are hospitalized who have no other explanation for their hospitalization and their symptoms are consistent with COVID, people who have symptoms consistent with COVID who live in long-term care facilities, healthcare workers or first responders, those who have symptoms consistent with COVID, have known close contact or have traveled to a place that has had known community transmission that has been moderate to extensive in the last 14 days. This includes the lower 48 as well as Europe and Asia. It's important to understand that the numbers that we see today really reflect what happened to someone a week ago, because we may not see those symptoms. They may have been at the grocery store with their kid, and their kid grabbed the handle that had live virus on it because someone just sneezed, and then their kid put their hands in their mouth and got a little cold, and that parent is caring for them, and then they now have the symptoms. And that is what's so hard about this disease. It may seem like such a small little thing that then results in this transmission, and then they go and visit their loved one, and then they give it to grandma, or they give it to someone who's pregnant, or they give it to someone who has underlying medical conditions. And that's part of the reason where we're having to do this really aggressive social distancing and physical distancing to try to slow down the spread of the virus in as many ways as possible. When we think about this disease and we think about this kind of silent killer that's spreading around, and as the governor mentioned, eventually, likely, most of us will get it. It can be overwhelming to think about what to do. And I think that's where I come back to our mission at the Department of Health and Social Services, and that's to promote the health and well-being of all Alaskans. It comes back to my own personal belief of doing what's right for patients. We have to do what's right for each other. And when I think about what that looks like and how we structure how we're responding from a healthcare infrastructure standpoint, I'm really thinking about the whole person. What does that look like from a physical standpoint? What does that look like from a mental standpoint? And what does that look like from a socio and economic standpoint? We know that all three of those things are critical for a person to be well and to be healthy. And we need to address all three. We do know that the fate of all Alaskans is really in our hands at this time, and these mandates that came in are essentially Alaska's version of shelter in place or stay at home, except the outdoors are lovely and they're not dangerous for you. So you can be outside, safely distanced from others, but stay away from other people as much as you possibly can. And if you work in those critical infrastructure industries like many of us do, having a plan to make sure how you keep that critical infrastructure up and how you keep yourself and your employees and those you work with healthy and safe. I think it's important to remember that you're not only doing this for yourself, but you're doing this for those frontline healthcare workers who are showing up to work every day, knowing that they don't have enough personal protective gear, knowing that they have a higher likelihood of getting and dying from the disease. You're doing this to help keep our economy and industry going, so there's people who can be working. But it's also important to remember that we're doing this for each other. You're doing this for the 24-year-old woman who's going to give birth and is higher risk, but also needs that hospital to deliver in later and not have it overrun with patients who have COVID. You're doing this for the 42-year-old mother who has cancer and 3 kids at home, who is immunocompromised and continues to need that healthcare infrastructure. You're doing it for our elders who hold our history and our tradition and our language, and we have so much to learn from. Including your parents or your grandparents like mine, who's in her 70s and has underlying lung problems but has years to give to my kids and her other grandkids, and thinking about what ways we can protect them. I think a lot about J.R. Tolkien's quote, "I wish this would not have happened in my time, but so do all who have seen such times. But that is not for us to decide. All we have to decide is what to do with that time that is given." And so I guess that's my question for you all. What we can do as Alaskans with this time that we have. I believe that we can be kind and we can help each other. We can stay away from others. If you run a grocery store, have hours for the elderly, disinfect regularly, have 6-foot distancing. Stay home if you're sick. Right now we're seeing a decrease in flu cases, we're seeing a decrease in other respiratory cases, and so if you have a fever, runny nose, cough, chills, aches, it's becoming increasingly likely that those are signs of COVID, and so it's important that you stay away from others, including those in your family. Isolate yourself into a separate room with a separate bathroom, and if you're starting to get very ill, that's when we ask you to call your primary care provider, your healthcare provider. Use the online resources that we've been posting on our DHSS website, the coronavirus.alaska.gov, posting on our social media on a regular basis. There's great online tools where you can go through your symptoms to see what your risks are. And this is where we're kind to each other. I believe that at the end of the day, we can adopt and we can learn and we can support each other. I believe what David Brooks says when he says, "When your plans are upset, the quieter and better you is beneath them." So I challenge you all to find your better selves, to find beauty when all else looks bleak, to find gratitude when it feels like so much has been or could be lost. And while we know that hard days are yet to come, for so many, also know that this too shall pass. So take care of yourselves, take care of each other, stay at home, and remember, we're stronger together.
Okay, let's go ahead and start with some questions from the news media. We're going to start in Fairbanks, and then we're going to move to the coastal communities in south central Alaska. Let's start with the first question from Aaron Walling with KXDF.
This is for Governor Dunleavy. Governor, is there any talks to limit essential business hours of operations, and if so, why is that the preferred option?
Can you repeat that? You were broken up just a little bit.
Sorry. Is there any talks to limit essential business hours of operations?
Everything's being discussed, and depending upon how this evolves, and it is evolving, and it's gaining steam, as we know. Again, almost on a daily basis, we will be reviewing what protocols we need to put in place next. Nothing's off the table, so all these things are being discussed.
Okay. Aaron McGordy, Fairbanks Daily News Monitor.
Hi, thank you. This question is for Governor Dunleavy. Recently, a group of about 50 doctors from the Fairbanks area sent a letter to Commissioner Crum and yourself, I believe, requesting for a shelter-in-place mandate for the Fairbanks area. What are your thoughts on that letter, and is that something that you would consider?
Again, everything is, we're receiving a lot of feedback from Alaskans, including groups such as you just mentioned up in Fairbanks. And we take it all very seriously, and we weigh it. A lot of things are being weighed here in terms of, does it advance our approach to dealing with this virus? Does it cause other issues if we go down a certain route? We're constantly talking about this. And so we look at everything, including the input, as I mentioned. We'll continue to do that. And again, our protocols evolve almost on a daily basis to deal with these issues. And this may be a tool, or this suggestion may be a tool that is put in place where we'll be having those discussions.
Okay, let's go to Margie Bowman at the Cordova Times.
Yeah, I'm wondering how well you think Alaskans will take your advice to not only wash their hands, but only go out when it's necessary to purchase things at the store or for a medical emergency.
You know, that's
for the governor. Thank you.
Yeah, thank you. That's a very good question. Well, so we hope they take our advice. Again, nobody ever thought we'd be standing here today talking about a pandemic in 2020. Nobody thought we'd be talking about a pandemic that is hitting our country to the degree it is, and our state. And so what we're trying to share with Alaskans is the best medical knowledge we have at this time to deal with this. Now, it sounds like it's old school. We live in a world of the best health care in the history of mankind. We have pills and vaccinations for almost anything, except for this thing today, as we speak. And so we have to rely on what we know, and what we know is it's spread from person to person by close contact. So how do you reduce that spread? You distance yourself. You wash your hands. You don't go out in groups. You minimize your contact with other folks until our healthcare professionals can build up the capacity to deal with folks that will get sick, but also gives our healthcare professionals worldwide, scientists, epidemiologists, those that study viruses and vaccinations are working tirelessly 24 hours a day around the clock to come up with a vaccine if we can, and antivirals to treat the illnesses if we can. But it's an issue of time right now. And so, you know, we're a free people in America. We're a free people in Alaska. And we're just asking folks to take our best advice. And there's no doubt this is a pain. This is going to be aggravating. This is really disruptive. But for the next 2 weeks, if we can give a little, we believe we're going to get a lot. And that's what we're asking Alaskans to do.
Okay, let's go to Megan Pacer with the Homer News. Megan, did you have a question? Okay, let's go to Iris Samuels with the Kodiak Daily Mirror.
Hi, this question is for Dr. Zink. I'm looking at the figures that were posted on the Department of Health and Social Services website today, and it looks like the number of tests that were performed yesterday is significantly lower than the number that was performed in the days before. I'm wondering if you could talk about if that's due to a lag in testing, and if you could talk about if the testing capacity in Alaska will increase as you see the number of cases increasing.
Yeah, no, I appreciate that. And I mentioned that earlier, so thank you for bringing that up. So the website is being updated. We'll start putting out cases around 5 p.m. every day instead of earlier in the day. So there's kind of a little bit of that lag time today. So if you check the website between 12 and 12:30 when they're normally updated, you're not going to see the cases. And the reason for that is because the way that we're batching them to be as efficient as possible, most of them are coming out somewhere between like noon and 4 p.m. if they're kind of running through the whole bit fairly quickly, and then we can get them up on the website and we can get that information not only out to you all, the media this way, but to the public on that website. So we're making some changes that way. We actually saw a big increase in the number of tests yesterday and another big increase in the number of tests today. That hasn't been reflected in the website as of yet because some of those changes as we're increasing. We do have 2 additional machines that we can use at the state lab. We are figuring out ways to get additional swabs and be able to get that out. We are looking to our federal partners, international partners, as well as locally, all the different things that we can do to make sure we increase the capacity for testing as we're expecting kind of an acceleration in cases in the state of Alaska. And it's a critical part of our containment effort as well as being able to help people make educated decisions.
Okay, let's go to Anchorage. Daniela Rivera at KTVA.
I'm Sarah. Thank you, Daniela at KTVA. I have a multi-part question. I'm wondering how many state employees are currently required to report to work, and then how many state employees are currently working from home?
So it's a good question. I don't have those numbers right now, but that's a discussion that's happening between employees and their supervisors. Again, you know, we are having discussions with our supervisors with individuals that may fall into some of these vulnerable groups, whether it's age or a combination of some underlying medical conditions. So I don't have those numbers right now. I do know that those discussions are happening, and we may be able to get numbers later, but we're not tracking those numbers.
Okay.
Can the Department of Administration possibly provide us that information?
I'd have a conversation with them to see if they're tracking the numbers. I'm not sure if they are, though.
Okay, thank you.
Let's go to Kyle Hopkins, Anchorage Daily News.
Yeah, hi. We've been talking to people today who have taken the test and have been told that they need to wait a week, maybe even 2 weeks to get test results, which would be a slower turnaround than other communities around the country are seeing. What is the reason for that long duration between the test being taken and the results coming in? And if the answer is, well, some of these are being sent out of state, how can you minimize those being sent out of state and increase capacity in Anchorage or in Alaska?
Yes, I appreciate that question. It's really up to each provider to decide where and how they're going to send the test. We do in the Health Action Alert talk about who we have state capacity to test for. So that whole list that I read out earlier, we said all of those send to the state lab. If someone is outpatient, older, and has mild symptoms, or if the clinician thinks that it's indicated for kind of no other specific reason, then we recommend sending those to one of the national labs because, as mentioned, we don't have a really good sense of that turnaround time. What we've been seeing is somewhere between 3 to 4 days for turnaround time for that. We are hearing of slightly increasing delays nationwide. We saw a 25% increase in cases recently in the lower 48. We're clearly on this acceleration phase down in the lower 48, and so testing across the country is being as taxed. We can't demand that people send us samples versus sending them somewhere else. That's their decision as clinicians on where they want to send it. We appreciate the extra support that's coming from the private labs to make sure that we're getting them back as quickly as possible. But we're continuing to increase capacity at our state, but we're also seeing private labs increase capacity. And I think this is going to be an evolving process as we see this disease process change throughout the country.
Okay, let's go to Tim Bradner with Legislative Digest.
This is for Dr. Can you hear me, Dr. Zink? This is for you.
Yes, sir, I can hear you.
Dr. Zink, can you hear me?
Yes, I can hear you, sir.
A question. This afternoon, the president gave a press conference in which he talked about standing down the national work at home. Arguing that the economy is really as important, if not in some cases more important. What is your view of, and the president was talking of doing this within 2 weeks, what is your view? Do you, as a medical professional, do you think that's advisable?
You know, it's a great question, and I think it's something that we struggle with on a regular basis. Is what does this look like? What's the prediction? We have a whole data informatics group that's doing a lot of modeling for us and helping to us understand, you know, what's this going to do for the healthcare? What sort of kind of social distancing measures we're going to take? I think that's really going to honestly be up to Alaskans. The more we act early and aggressively now, the more we slow it down later, and the more we can kind of slowly open things back up without having huge health consequences. The spread of this disease and the rate of it is, you know, it grows at an exponential force. It's hard for me to predict what 2 weeks away will look like. However, I do know that, you know, social distancing and staying at home forever, and, you know, the mandate that was read previously is essentially a shelter-in-place mandate, except it allows you to be outside in Alaska. It's essentially trying to close down all of those ways that we connect with each other in a physical way. That isn't sustainable long term, and we are very aware of that, and we are trying to model that out. We also understand the epidemiology in Alaska is slightly different than the lower 48, and our 100% mission is the health and well-being, and that's that full health of Alaskans, and making sure that we're giving the best advice that we possibly can using our counterparts in the lower 48 as well as around the world to influence that decision. And the timing of that is something that we hotly debate and look at on an hour-by-hour basis.
Grant Robinson.
Dr. Zink, can I ask a follow-up? If in 2 weeks we're still accelerating cases in Alaska and the president orders a relaxation of the stay in place, what should we do in Alaska? What would you do, Governor?
Yeah, Tim, that's a policy call for me, not the doctor. The doctor's focused on the health of Alaskans. We'll have to cross that bridge when we come to it, but there is some merit. I think all of us realize that the idea that we're going to hunker down for months and months and months on end and the economy is going to take care of itself, I think very few people believe that's going to be the case. And so what we're trying to do now is focus on the next couple weeks, again, that we believe will build capacity for our healthcare professionals to deal with what will be an increased number of cases of this disease. But the economy is not going to work without people working. The economy is not going to work without people buying things and services and products being moved. Just like the government's not going to work unless we have folks here to help man the station. So we have these discussions. I have these discussions with the doctor and other medical professionals trying to understand how we can gauge what we're doing. But in the end, we have to have an economy. And as the doctor was alluding to, in the end, we are social beings. There will be a time, regardless of how this pans out over the next several weeks and maybe months, there'll be a time where the people themselves will say, you know, this is not how we want to live our lives, hiding and running consistently, constantly. So we have those discussions, but that's really a call for myself and other policymakers. We rely on Dr. Zink, Commissioner Crum, and other health professionals to stand up and approach this virus in a manner that's going to provide the best case possible, the health, safety, and welfare of Alaskans. But we don't know how this is going to turn out. We don't know how this is going to pan out, I should say. I personally believe that this is going to not be the end of the world. There's no indication of that. But could it really impact our economy? Could it send our economy into a recession and possibly a depression if we're not careful? Yes, it can. And so we're going to have to take a look at that and have those discussions. But I don't want anyone out there thinking, Tim, that what I'm saying is the economy is worth more than somebody's life. I'm not saying that. But what I will say is that for generations and generations and generations, people have had to deal with these pandemics and these viruses. And they've also had to get up in the morning and be able to feed themselves and make things run for society. So it's going to be an interesting conversation, and it has been over the next few weeks, and how we pull ourselves out of this and how we get back to living normal lives.
Okay, let's go to Grant Robinson with KTVU.
This is either for the governor or Commissioner Crum. When the mandate requiring people coming into Alaska to self-quarantine for 14 days takes effect, Commissioner Crum said that visitors can go to their designated hotel or rented lodging. Does the state have any controls in place to track where those visitors are being quarantined? And also, what is in place for those who are coming across the Canadian border?
You want to try? You want to take a stab at it?
Yeah. Okay. As the visitors enter Alaska, primarily at the airports of Ketchikan, Juneau, Anchorage, and Fairbanks, we have a mandatory declaration form where they're actually going to have to tell us their location of where they're going to self-quarantine over that time frame. So that is how we are going to track that. As far as the individuals coming across the Canadian border, that is another discussion on this. This one right here is looking at the bulk of the passengers and the people from out of state entering Alaska are via air travel.
Okay, let's go to Southeast for a question or two. Molly Barnes, Alaska Landline.
Hi, yes, I was just wondering, so you said that this is essentially a hunker-down mandate. However, it's not really labeled as such, and it's kind of spread out over a bunch of different mandates. Can you clarify how this is different just for the public, and is it less restrictive or more restrictive than what's currently in place in Anchorage, Fairbanks, and Ketchikan?
You want to just talk about
Well, thank you for that question. So the reason is when we put this statewide, and the explicit purpose of this, the mandate is to limit all close contacts of people outside the family unit to be farther than 6 feet away to prevent the spread of the virus. It also is limiting gatherings of no more than 10 people, and if a gathering does take place, 6 feet or more. And so this is something that we're really saying across the state of Alaska, stay away from each other. Social distance. Try to work from home if you can. If you're in a workplace that you have to go attend, make sure that you have your space safely away from each other. And just to make sure that we're taking care of each other. These, I don't know the specifics of Ketchikan. I don't believe the other city you mentioned, and in Anchorage. But, you know, we wanted to make sure that Alaskans understood with this. This is, we want each other to take care of each other. You get outside, get your fresh air, but also make sure that when you go out, be responsible. Understand that the distance in the grocery store matters. Where you stand next to somebody as you go through produce matters. Look at your spot in line. Only bring one person instead of 4. And always pay attention to that. And this is where we're really trying to implore upon the state of Alaska. This is one of those things that, as both the governor and Dr. Zink have mentioned, if we all really try and heed and comply with these, then we're actually going to make a much shorter turnaround as far as where Alaska comes out on the other side of this pandemic.
Okay, Eric Stone, KRBD.
Hi, so this question is for either Commissioner Crum or Dr. Zink. So Commissioner Crum said last week regarding testing, quote, if the provider wants to send a sample and send that in, we will run that test, unquote. I ran that exact quote by Peter Weiss, the medical chief at Peace Health Ketchikan, and he said that didn't quite square with what he was hearing. He says he can only send tests to the state if the patient falls into the state's high risk categories that Dr. Zink outlined earlier. He says for medium and low risk patients, as outlined in the health alert, his only option was to send it to a private lab, and the private lab that Peace Health Ketchikan currently uses is not accepting tests from those patients due to capacity issues. So I just wanted to get some clarity on that. Can providers send state labs samples or tests from medium and low priority patients, or are state labs not accepting samples that don't meet that high priority criteria?
So again, I think that there's the HAN, or the Health Action Alert, that determines who should send which test to which place. That changes on a regular basis for us to be able to respond to the epidemic and the pandemic that's responding. So a couple days ago, that did change so that low-risk people are asked, we send those samples to an out-of-state lab. There are out-of-state labs that continue to process samples on a regular basis. We're seeing a significant increase in labs being sent that direction. And so, you know, I don't know the direct details of where Peace Health sends theirs or how they send theirs, but they are correct in the sense that at this moment, at this time, high and medium risk, we're asking to be sent to the state lab so we can get those turned around. And if they're low risk, then those are the ones that we are encouraging to send to one of the state labs. That's all public information. It's under the healthcare providers tab on our coronavirus Alaska website, and it has it listed by the date and time. Everyone can take a look at that. You can post it in your clinic and continue to keep those updated because they do change on a very frequent basis as we respond to this epidemic, really trying to promote the health and well-being of all Alaskans.
Okay, we're about out of time here. We're going to take one.
And sorry, just to follow up, so high and medium risk patients are being accepted at the state labs.
Yeah, please take a look right at the state website because it's specifically listed out there, and you can go through every single one. I don't have a copy right in front of me, but I had written it down. But the high and medium, it's all right on there.
Okay, we're about out of time.
Can I follow up on that?
Okay.
I just have a question about if you know, the tests are not preventative, wouldn't it make more sense to quickly turn around and identify the people who are not showing symptoms and might be, you know, asymptomatic super carriers who are out spreading it, but not showing symptoms?
100% agree. If I could have 2.5 million tests right now, so I could have enough to test everyone in Alaska a few times, because they're likely going to need more than one test, I would take it. And we are doing absolutely everything we can to increase that capacity. But just as, you know, I don't wear a helmet while I'm standing here talking to you, but I do when I ride my bicycle, we have to use the tools that we have as effectively as possible. And this is one tool that we have. It's a limited tool. We are doing everything that we can, including trying to figure out how to produce additional stuff here in the state on our own to increase that capacity. But we have to use that tool wisely, and that's why we have those HON alerts.
Okay. Thank you, Eric. Becky Bohr, Associated Press, final question, please.
I might just wrap up for all of this.
Okay. I'll give someone else a chance. Andrew Kitcheman, KTOO, final question.
Thanks, Jeff. What measures are you using to decide whether what you're doing is enough? And is the spread of community transmission evidence that the state maybe hasn't done enough so far?
Well, that's the million-dollar question. And I think that that's the real challenge and what we're trying to figure out. Again, we have a disease that silently spreads or very mild symptoms for a week or more before someone is actually symptomatic. And we have limited ability to test for it. We don't understand the virus well. We don't have a blood test for it. We are learning as fast and as much as we possibly can. And so what we're doing to make sure that our measures are as effective as possible is reaching across the state, across the country, and across the globe to learn from as many scientists, as many industries, as many countries as we possibly can, from talking to my colleagues in Taiwan, to the CDC, to Seattle, to New York, Texas on a daily basis, trying to process all this information. And then, like I mentioned earlier, we have a whole data team that's tracking our numbers to try to figure out what's the transmissibility, what does our testing look like compared to other states. So some states are incredibly limited in their capacity to test and are seeing really long turnaround times to get their tests back. They're only testing people who are admitted to the ICU, not even testing all patients who are admitted to the hospital. And so we have to interpret those numbers in different ways. So it's with all of that that we're trying to put this together. So I really appreciate that question, and I know that we're running out of time, and I just want to wrap it up by just really thanking everyone. This is really, really hard to ask people to socially distance. If we had every test and could have each and every person have that test, know exactly what that test meant, if we had a way to protect all Alaskans, we would do it, and we would share it in a heartbeat. I really want to thank our partners, industry standing up. It's wonderful to see the weddings that have been done via social distancing, the drive-through, the ways that people are coming up with creative solutions to take care of the elders and those who are most vulnerable. I think that challenges like this bring out the best, both the best and worst in all of us. And I just really appreciate all those Alaskans who it's bringing out the best in all of us. We'll get through this, and it's going to get better. And this is really hard, but it's going to get better. And we'll do everything we can to keep you as informed as we possibly can with the most timely, accurate, truthful, transparent information we possibly can. Thank you.
So I want to thank Alaskans again. This is going to be a challenge. There's no doubt about it. This may even be a game changer. No doubt about that either. But this is not going to be the end of the world. As we know, when we study our history, we've gone through this generation after generation after generation. We've had our challenges. And we have the society and the civilization we have today because we've overcome these challenges. We've become better and stronger. There was a time a lot of these diseases, folks thought it'd be the end of the world. We overcame them. Science, medicine, vaccinations, antivirals all came into play, hospitalization, better hygiene. And so, again, this will be a challenge, but it's not something, I don't want Alaskans being afraid. I certainly don't want anyone getting hysterical. And what we have to do in Alaska is we got to get the two sides of this equation to come together. We have folks that are clearing off the shelves in the grocery stores, are hoarding things, thinking that things may shut down for some time. On the other hand, we have folks that are acting like nothing's going on. that there's no issue, there's no problem. It's really the middle ground we're looking for. We shouldn't be afraid, but we also should be concerned, and we should change our behaviors. We change our behaviors, as the doctor said, and that we've been talking about for some time in these press conferences. It will help slow this virus down. And in the end, it will help save lives. There's no doubt about it. It's a pain. We know it. It's a disruption. We know it. It's going to be tough. I mean, it's going to be tough. I don't know about you, but, you know, all of us living in the same house and not getting out as much as we once did, it's not going to be easy. And so it's temporary, though. This is not a permanent state of affairs for us. You got to give us a couple weeks. We got to dig deep. We got to really work together on this. We got to look out for each other. I mean, I'm hoping we don't hear of any price gouging on the part of some folks that sell things, or extreme hoarding, or even worse, preying upon people during these times. That's not what Alaska is all about. Over the next couple weeks, we can demonstrate to ourselves, and really to the world, what happens when a free society, America, with one of the freest states, Alaska, comes together to really tackle this thing head on. Deal with it, alter our lives for a little while, but then come out on the end, the winning end of this, stronger end of this, making a stronger Alaska. We'll be updating you, as we say, every day. Things will keep changing. There'll be more cases. There'll be more hospitalization. And there will be some people that will pass away as a result of this virus. But again, through working together with us, folks in the healthcare industry, and just working with your neighbors and your friends and your family, it's going to make a big difference. So with that, I want to thank Alaskans, thank the press again. We'll be back tomorrow, and we'll continue with the updates.